And I'll be reviewing in this webinar today the new ACA functionality within the M3 installed version and Payentry, our online payroll and HR solution. As you know, the Affordable Care Act and its reporting requirements are quickly upon us. Starting January, these 1095Cs will need to be provided to employees along with the 1094C reconciliation provided to the IRS by January 31st. Well, that's the employees' 1095Cs. The actual reconciliation is due later. But in any event, we're pleased to announce that all of the ACA functionality is built within these systems to provide you with the tools to accurately report this information. Within Payality, we're going to be providing 3 methods now for populating the data within the system. These 3 methods are one manual. You can use the ACA tab for each individual employee to populate the needed data one employee at a time. We also have a bulk update feature. Now, many of our clients were using the bulk update to set statuses, whether they were considered full-time or part-time or variable hour or seasonal employees. Now, this bulk update tool has been enhanced to do bulk updates on the coverage values and so forth related to the 1095C reporting. And so that bulk update option is there, and we'll demonstrate that as part of this presentation as well. And the third is the automatic code selection, where we're now using the system level, company level insurance plan tabs within the system and the ACA tab to gain insight into the type of coverages being offered and how that information will translate automatically onto these new reporting forms. So, whatever the choice of the client, the method chosen by our clients, Payality is going to create an Excel file for client review on January 5th of 2016. So it's going to take all of the data within that system, throw it out onto an Excel spreadsheet for review by our clients. So kind of as a secondary double check of the information that is stored within the system. And a copy of this presentation will be sent to all attendees, and there's an excellent link to questions and answers, frequently asked questions as it relates to the employer chair responsibility and so forth. So let's look at this 1095C form and kind of some of the most important pieces of it. There really are 4 important elements to this, to the 1095C. The first, part 2, is box 14, the offerage of coverage code. What specific code applies to this individual, and we'll go over that in more detail. Box 15 is the employee share of the lowest cost health plan, minimum essential coverage plan, that's MEC, and we'll go over that in a little more detail. And then also box 16, the safe harbor code, if applicable, in box 16. And then finally, in part 3, did you, as an employer, provide any self-insured health plan coverage? And that will expand the type of information that will need to be tracked in the system. So we'll talk about each one of these. Let's go into box 14, the offerage of coverage code, and look at the different coverage codes that are defined by the IRS. First, one could be this 1A, this minimum essential coverage that provides a minimum value offered to the employees for coverage just for themselves that is less than 9.5% of the federal poverty line, which this year in 2015 is $1,118. To translate that, what that means is that if what the employee contributes annually for coverage would be less than that, their part, then you meet this minimum essential value and minimum essential coverage, or the minimum value calculation at least, and it's referred to as a qualifying offer. Now you may have one of these traditional plans, regardless, you're not tracking every single employee. You have some that are paying more than the minimum value, more than, you know, $1,118 for coverage for themselves. So you would have some of these other criteria. Perhaps it's employee-only coverage, but it's not offered to their spouse or dependents, or it's offered to the dependents and not the spouse. It's 1C. 1D is it's offered to the spouse but not the dependents. 1E, it's offered to the employee and offered to their dependents and spouse. So that's probably the most common, is 1E. Or it's a minimum essential value policy, but it's not affordable. It didn't meet the 9.5% minimum value to the employee, and it's either offered to them, their employee and spouse, or dependents, or their employee, spouse, and dependents. Now, I know this is all. There's a lot to this, and I would highly encourage you that you make sure that you're working closely with your benefits broker to know exactly what these codes should be for Box 14. It's going to be critical that you're in it, that you're speaking with them, and that they fully understand the type of coverage is being offered to whom and so forth. We did, as you know, for our Payality clients, provide a questionnaire that would help give us insight to know which code to use in Box 14 and set that up on the company side and provide that for you. So I hope you've taken the time to fill out that questionnaire and return it to your payroll specialist. One of the other offers is that you're not offering coverage at all, and they were not covered on the plan. Yeah, so that's could be the case. You have over 50 employees or 100 and you've done that. Or you have transition relief. And so for at least 1 month of the year, and they didn't receive a qualifying offer. So you may be in transition relief. You're under 100 employees, but over 50. You're still required to give the form, but you have this transition relief. So Box 15 is the employee share. So if you chose between Box 1B and Box 1E, then you need to show what would have been the employee's share, what's coming out of their paycheck each month to cover the lowest cost plan that meets the minimum essential coverage that provides minimum value that's offered to the employee, not what they took, but what was offered. So you need to track what was offered to that employee of the cheapest plan. So let's say you offered a Blue Cross, you offered a Kaiser plan and so forth, and Kaiser cost $40 a month out of pocket, Blue Cross was $60. Even if they chose Blue Cross and you offered them Kaiser, you need to put in the $40, which would have been the lowest cost plan for them in these boxes for the months that they were offered coverage. So that amount, like I mentioned, may be different than what the employee's actually paying out of their paycheck because they may enroll in a more expensive plan, such as family coverage or the higher cost Blue Cross plan. But it has to be the amount for the lowest cost plan within there. And show only if, like I said, they're code 1B, 1C, 1D, or 1E in Box 14. So you have to coordinate that as well. And if the employee was offered coverage but not required to contribute, then you would put a 0 in this field. So you may offer 100% coverage for employee-only coverage on that plan, but it was offered, it's 0 to pay for it, and so you need to show that. Now, Box 16 is a safe harbor, and you have to show why that employee or you should not pay a penalty. And let's talk about these. There's a lot to this, but first is the employee is not employed during any day of the month. Keep in mind, these are annual forms, so even if you hired someone in September, you are still going to need to report before then, from January through August, that the employee was not employed during any day of the month in those appropriate boxes. Or if they terminated in June, and you would have to report that they were not employed during any day of the month. Or if they are not a full-time employee during any of those months, and they didn't enroll in minimum essential coverage, or if they were a full-time employee and then coverage ended, so let's say they terminated before that end of the month, then you would have to put in to be in that box. They enrolled in coverage. It's probably going to be the most common. They enrolled in your health coverage and were covered on it each day of the month. This is talking about for themselves. And so you put that. You may have a waiting period, and we'll talk about that on the insurance plan setups later, but you may have a 90-day waiting period before, or 60-day now, waiting period before the employee's eligible for benefits. So if they weren't covered on that plan because they're in the waiting period for those months they were covered by the waiting period, you're going to have to put this code in those boxes for that month. So let's say they're hired in March, coverage started June 1. You would have March, April, May would be code 2D for that employee. Or if this is the first year that you were subject as a large employer in 2015, then you did not have to offer coverage in January, February, and March of this year. And so you would have transition relief. Let's say you implemented the plan starting May 1 to be compliant, or April 1 rather, then you could put transition relief across the board for all employees using this code 2D. Multi-employer, I won't go a lot into that. Doubt if any of you will have this, but there's transition relief there as well. If they were covered by another employer and so forth, maybe, there's a lot of different scenarios. But anyway, and we have links to that to give you more detail. Or if now, did you use Safe Harbor to determine the affordability if it met minimum value? So there's a number of different ways to do Safe Harbor reporting. You're looking at their W-2 wages and just saying if it's less than 9.5% of their W-2 wage, what their contribution is for their plan, the lowest cost plan, then you're using the W-2 Safe Harbor and have to indicate. Or if you're using the federal poverty line Safe Harbor, then you would put 2G in this field. Or if you did the rate of pay Safe Harbor, then it would be 2H. Again, you'll want to look at and coordinate with your employee benefits broker, and also leveraging the payroll information that's available to look at if it was minimum value and have the appropriate code. Or if you have multi-year transition relief, so you have a plan that crosses over years, you just became newly a large employer, there's some rules related to that that are a little complex, but, and again, I put a link here in this presentation so you could track that as well. And then finally, did you offer a self-insured health plan? And if you did, then in addition to the employee data, you're also going to have to begin to track the name of the covered dependents, there's the dependent social security number or date of birth, and the months of coverage that coverage was offered to those dependents within the plan. So let's talk about the three methods that are available, and then I'm going to go into the system. I did want to say that the M3 installed version has been updated. If you have followed the instructions on the update we provided for those that have the installed version, those updates would have already applied, and you'll see these applicable screens. Pay Entry, our online solution, the updates are going to be published on October 17th. And so these additional screens within the ACA tab on the employee level and at the company level will be available beginning October 17th. But I wanted to go ahead and go over each one of these methods. The first is the manual method that you would do by employee. If you go to the ACA tab within the employee screens, you'll notice that there's a new drop-down called Coverage. This coverage will allow you to set the effective date of the current year plan for those full-time employees that were benefit eligible. And here are the corresponding boxes to the 1095-C. So what months were they covered? Did they have an offer of coverage? What was the code that was used? What's the offer of coverage code? And what was the employee share of the lowest cost plan per month that the employee would pay? And what's that employer relief code? And then are they self-insured? Let me show you the actual system here so we can take a peek. So here's Denise Johnson. If you go, here's the employee setup. So, their main demographic tab and so forth. Their, demographics. There's an ACA tab now. The one that you saw before was the ACA status. So you were able to go in, check their status. Are they a full-time employee? Were they part-time? Was it unknown and so forth? We've previously provided training on this, so you would have seen, and many of you have already updated this information. But now there's the coverage code. So you'd be able to go in and set the effective date for this year. So if they were hired before, they were for this year, beginning January through December, and this just goes out to an eternity, or you could put December 2015 if you wanted, if things are going to change here. But offerage of coverage code. So what were they offered for that individual employee based on what I showed you previously? What is their contribution per month? Their out-of-pocket contribution for the cheapest plan, the employer relief code that I showed you previously, and if they're enrolled in the self-insurance plan. So if you want, you can go into each employee and update these ACA coverages. So that's one of the options that are available, and you could begin to do that in M3 immediately, or you can go ahead and do this in pay entry beginning next month. Now, one of the next things it does in this manual method is that it'll give you the ability to view data tab, which is, you have the coverage and the view data tab, and it's going to look and show you exactly how that 1095C is going to come back and detect any missing data. As I mentioned earlier, this is a full year reporting requirement. Even if that employee became benefit eligible in September because they were hired or whatever the case, all of the months of the year have to be filled out. And so it's going to do that, and then you're going to have to go back in the coverage side and update for the remaining time. So you would set up a new date and say from January 15 until through August of 2015, the employee was not a full-time employee. This obviously there'd be no value, and you would have that employer relief. They weren't an employee during that time. So you're going to have to set up and manage that data for the full year. The second method is the bulk update. So we recognize for many of our larger clients that would be tedious to go in and update each individual employee. So previously within the system you had the bulk update, ACA bulk update tab that allowed you to change the statuses. So it would look, and you could grab a group of employees. If you updated the employee status to, let's say, regular full-time, you could filter out, grab all of those regular full-time employees and change all their statuses to full-time. As you know, there was also the ACA audit that would look at how did you have those employees categorized, part-time, full-time, and so forth. It would look at the actual hours worked over the measurement period and then go ahead and place what their actual status is based on actual hours reported for that previous period of time. Well, now it's added the functionality to update the coverage to groups of employees. So within the system, you're going to update their offerage of coverage code for groups of employees that have the same values. So what some clients may choose to do is go ahead and blanket set the same thing for every employee, what is the most common, and then go back on an individual employee and change those that need to be updated differently from what this bulk update that you did. You can apply the employer share, box 15, across the board for the filtered employees or the chosen employees within the filters that you use, and the employer relief code and the self-insured code. So it allows you to handle multiple employees at once. And here you go. So you select those group of employees, you click to update, and then you update the box 14, 15, 16, and the self-insured boxes. One of the beauties of this too is, as I mentioned previously, and In the manual effort, if you had an employee that was hired, let's say mid-year, it's going to go back and look at hire and rehire dates and so forth and add records there to show that they were not employed during that time, or it'll look at term dates and so forth and add records to fill in those gaps so you do not have the red missing deal when you do the view data code in there, so that it's covering the full year span of information automatically and populating data within that system. And so if I went out again into this record, and I'll show you exactly where it is. So within the company tools, you can go into the ACA tab, and then again go, well, let me go here actually into the bulk update rather. So you would have all your employees listed. You can filter again under the ACH coverage code. You may want to, if your employee types have been updated, you may want to just grab regular full-time employees, part-time, whatever the case may be. Their statuses, do you want all employees? Do you want just terminated employees, or whatever the case may be? And then based on those filter, it's going to give you a complete list, and then you can select all, click Update Selected, and then begin to set the values that you want. Across the board, here's box 14 information, box 15 information as far as the employee share across the board, the employee relief code that would be applicable to every single employee you have there. You'll notice that within the system itself, it allows you to say do not change employees who already have these values set. So if you went in and did some of this setup on employees, then you could go ahead and tell the system, don't change those people. I want you to just update from the selection that I made, go in and make those updates. So once you set all these values, you just say OK, and then it'll update, and then you're going to see the new offer of coverage code, the employee share, the employer relief code, were they self-insured, yes or no. So this system has that bulk utility update as well. And so if you want to do that, save you a bunch of time and go in and use that bulk utility, then you certainly can. The third method is the automatic based on the insurance tab setup. We've always had the insurance tab within the system. A number of our clients have wanted to track the different plans offered to the employees. They could be health plans, dental plans, vision plans, and so forth. But for purposes of the Affordable Care Act, if you are not currently using this tab, and you want to use the automatic method based on this tab setup, we would encourage you at a minimum to add the health plan that is the lowest cost out of pocket to the employee. And by entering this data, you will also be able to record some key information that is needed to populate the 1095Cs for the employee. For example, you're going to put the coverage dates. So this coverage may have began January of 2015, and it goes on, let's say, in perpetuity. That's kind of our code. 2100 means it's going on into infinity. But in any event, is it minimum essential coverage? Does it meet the requirements of the Affordable Care Act to cover 60% of the employee's out-of-pocket expense? There's other criteria there, but is it that in most of those bronze level plans? And does it meet the minimum value requirements? Is it cost the employee less than 9.5% of their pay? Is there a self-insured component? And is the coverage offered to just the employee? Is it offered to their spouse or to their dependents as well? And so that's a key component of that, and I'll show you on the other side. In addition, you'll want to set up the premiums, because the system needs to know, and you saw if you were using the manual update or the bulk update, you were setting values of what the employee's out-of-pocket costs would be. The beauty of this is it allows you age banding. So if your plan has age-banded rates, it allows you to build that in and set these age bands. At a minimum, I would certainly set what the employee's costs are. The spouse, child, and family aren't necessary as it relates to the reporting for the 1095Cs for the Affordable Care Act, but at a minimum, you could set the age range here and then show what the monthly cost is, what the total cost of the plan is, and then alternatively, let me go back, sorry. and then alternatively set what does the employer contribute towards that plan. What we see a lot commonly is that the employer will cover 50% of that cost. And so in this case, the system's going to look at and say, okay, I've got a 42-year-old employee. The total cost of the plan to the employer is $250, but the employee is going, of that $250 total cost of the plan, the employer is going to contribute 50%. So I know the employee's out-of-pocket cost for that coverage is $125 a month. So it'll cover, it'll track that. And then the last is to look at eligibility so that it can put those appropriate codes to say there was transition relief here because the employee was in the waiting period. They weren't offered benefits at that time, so that it could choose the correct code. So we've added an eligibility tab here to say all employees, or you can set group of employees, are eligible to begin the plan starting on the first of the third month employed, or the second month, whatever your plan. Your benefits broker will know how that plan works. And then finally, within the company ACA tab is setting up the other information that's needed. So when is that plan eligible? Are you using the qualifying offering method? Are you using transition relief so you aren't subject to that plan? So this will check all those boxes. And if so, what transition relief did you have for the box 16? These all play out. Again, we will assist you in that information. But again, that questionnaire that we provided previously is really going to give us the information needed to do this. And so let's go ahead and look within Millennium and show you how all of this data will be there. So the first is going to be the company insurance plans. So as I mentioned, at a minimum, you would want to set up the plan that has the lowest out-of-pocket cost to the employee for the plans that meet all of the minimum essential coverage and minimum value requirements of the Affordable Care Act. And so in this case, I have a Blue Cross plan. I would set up the contribution percentage, so the employer is going to contribute up to 50% of the cost of the plan. Of course, you may limit the amount that would be paid at the plan. And then the coverage. You may have one composite rate for all. The most critical is that you have an employee, the total cost of coverage for the employee if they chose this plan. You know, obviously, the employer is doing 50%, as I mentioned, and then set the eligibility tabs. So this will translate to the information that and automatically calculate what needs to go on to the 1094Cs. And then in addition to that, you're going to set their current plan years, the offer, the qualifying offer met, box 14, this box 14, box 16 is either the section 490H, or so you have transition relief, you're a 50 to 99 employer, you didn't have to offer benefits and so forth, so you can choose that. And so those different methods, there you set that up. And the other thing is that we have full ability if you are an aggregated employer, meaning that there's common ownership amongst multiple corporations, or let's say that we're running multiple company codes under the same tax ID for whatever purposes, we will be able to set up those aggregated groups for purposes of reporting and for the 1095, the 1094Cs and so forth. So by setting up this and using this automated method, it's going to calculate what should appear on the 1095Cs and the 1094C. As I mentioned, whatever method is chosen, the system is going to automatically, we are automatically going to create an export on January 15th into an Excel format so that you can see all of the employees, that data entered, and make any updates in that spreadsheet. Then we'll be able, with those updates, to re-import that data into the system and update it in preparation for preparing the 1095Cs. We'd want that information back by January 15th, and then our goal is to have all of the 1095Cs back in hand by the 25th of January, well before the reporting deadline. not the reporting, but the deadline of providing these 1095-Cs, which will be February 1st because January 31st is falling on a weekend. So steps to take, determine the method that you want to use, the manual, the bulk update, or the automatic. Ask your insurance broker, what is the offerage of coverage code, and determine if it's meeting those minimum values. And also what the employee, help us understand what your plans are and what the lowest cost plan is, so that that data can be populated on the employee level. And then the offerage of the shared responsibility or the relief codes as well. So for each attendee of this meeting, we're going to send out this presentation so you can look at each one of those box 14, 15, and 16 requirements and begin to compile that data and begin to aggregate that information within the system. Of course, your payroll specialist and others will be available to assist you in this effort. And again, thank you for attending today, and hope you found this information helpful.